Sounds good. No, totally informal. Happy to introduce myself. So thanks for having me. Nice to meet you guys, and we look forward to coming to Laramie in about 2 months to visit. So my name's Keith Mann. I'm a med-peds trained physician, practiced mostly pediatrics throughout my career. Spent early time in kind of graduate medical education, and then later in my career in quality improvement. But throughout that, did work as both a general pediatrician as in the community as well as a hospitalist. So did a combination of both in my clinical career. And then about 5 years ago, joined the American Board of Pediatrics, and now oversee the continuing certification program. So that's what I'm going to chat about today. I'm going to share my screen. All right, is that showing up okay?
Yeah.
Great. So again, just a relatively brief presentation today, just a handful of slides about the American Board of Pediatrics, an overview of the MOC program, and then I'll jump in and do a portfolio demo. Sometimes it's hard to know where to find the things we're talking about on our website. So I'll do a brief demo and then should have time for questions if there's any at the end. So just a quick slide showing the vision and mission of the ABP, and I show it in many ways because it aligns with the vision and mission of many organizations. We're at our core an assessment organization, a certifying body, but the goals are the same. Sometimes we just accomplish them through a slightly different lens. What I really wanted to highlight as well on this slide is the last of our transformational strategies, engagement and enduring connections. There is no doubt that the MOC program is better when pediatricians have input into it and engage in it. Our goal is to be partners with pediatricians in the continuing certification journey, not to be a top-down organization that imposes requirements on people. It's to do so in partnership. I know it doesn't always seem that way, and I know that there's been issues in the past in relationships with the board, but my goal is to engage pediatricians in their pursuit of lifelong learning. And so Kimberly and I, our goal is to get to every AAP state chapter in the next couple of years. We've been to probably 15 or 16 or so in the last 2 years, and we really appreciate the invitation to come out and meet with the pediatricians in Wyoming, both to share information about the program as well as to listen to the pediatricians in your state and what their needs are. So the ABP is made up of employees. We have a location in Chapel Hill. Our offices are in Chapel Hill, North Carolina. But there are about 4 times as many physician volunteers as there are employees. So we have over 400 physician volunteers. Those make up a board of directors made up of 10 pediatricians and pediatric subspecialists, as well as 2 public members. We have a general pediatrics committee, about 40 to 50 general pediatricians who both advise the American Board of Pediatrics on behalf of the general pediatric community, as well as write questions for the general pediatric certifying exam, and then for MOCA Peds. We have 15 subboards, each with about 10 to 12 members who advise us in the subspecialty arenas, as well as write questions for the exams for, behavioral and developmental medicine and infectious disease and the other 15 subspecialties. We have a family leadership committee to help us see the certification world through the lens of the patients and the public. And then we have different service committees. So I have a committee of pediatricians, as an example, that advises me on continuing certification. There's all sorts of other different ways to volunteer with the ABP. And to the right of your screen are ways that I've mentioned here, as well as smaller ways, things like standard setting or practice analysis, which are one and done kind of volunteer opportunities. So practice analysis actually helps us understand what pediatricians do in practice, and that survey-based process ends up helping populate our exams. So we try to populate our, especially MOCA Peds, with an understanding of what's happening in pediatric practice. Standard setting actually has pediatricians who take the exam and help us set the passing standard. And so all of the work that we do is done in partnership with pediatricians. We really rely on pediatricians from around the country to volunteer with us. This next slide shows you where those pediatricians come from. And as you can see right now, we have no volunteers from Wyoming and some of the states that are surrounding Wyoming. So you can imagine the states that have less pediatricians have less opportunities for volunteerism. And so one of the things when I come out there, I'd love to chat with pediatricians who might be interested in volunteering from your state in one of many numerous ways. So to jump into a bit of an overview of the MOC program, and then some of the nuts and bolts and some of the things that we're trying to do to add value to pediatricians over the last 5 years. So the program overall is kind of captured a QR code on the screen or just on our website. The things on the left-hand side, what's traditionally been known as Part 2, lifelong learning, or Part 4, kind of improving professional practice, or now improving health and healthcare. Those are requirements independent of how many certificates you hold with us. So if you hold 3 certificates with us, as an example, those requirements stay the same. What changes is the exam. So if you are a pediatric infectious disease doctor and keeping up your general pediatric certification, we ask that you do MOCA Peds for both because the content is specific for both. And so we don't have enough overlapping questions, and we're already minimizing the number of questions in MOCA Peds. And so we do ask that the pediatricians who are also subspecialists do both if they wish to stay certified in both. So jump into those requirements a little bit. So the second, one of the big components of continuing certification is around lifelong learning and self-assessment. And what we've tried to do is both align that more with opportunities that you all have in your careers, as well as produce things that we hope are value add to you. So the first 2 boxes really align more with what you're doing in your career. So we partnered with the Accreditation Council for Continuing Medical Education about 6 or 7 years ago, so that most CME activities also can count for MOC Part 2. There's an overlap. And so, for example, if there is a national meeting, if you go to the AAP NCE meeting in Orlando this year, there's probably upwards of 20 CME and 20 MOC Part 2 credits that you can get from attending that meeting. It's aligned now. If you are ever attend online grand rounds, for example, at an organization, many grand rounds now are also MOC Part 2 and CME accredited. And then if you use UpToDate, if that's your online mechanism, as an example, to look up information on patients, you've always been able to get CME for UpToDate. There's a category called Internet Search and Learn. And now you can also get MOC Part 2. So you can actually link your UpToDate account both with CME and MOC Part 2 and claim credit for those activities that will then jump directly into your portfolio. So all of this CME alignment happens in the background in some ways without you knowing it. So if the activity is registered for MOC Part 2, when you claim your CME, you answer a handful of more questions based upon what the CME provider is asking, and then the credit kind of just passes into your portfolio in the background. So it's a nice seamless way. So we have physicians now with hundreds and hundreds of MOC Part 2 points that are just happening naturally. The other thing we recognize is there are things you're doing that should count for CME credit or MOC Part 2 credit, but there's no easy way to make that happen. So resuscitation certificates are probably the best example. If you're keeping up your basic life support, that's the best form of self-assessment in the way that those are done. There's a standardized curriculum. There is a simulation-based self-assessment, whether it's done online or in person. And then there's a quiz at the end. And that's true for PALS, neonatal resuscitation, advanced cardiac life support, trauma life support, and almost all of the other ways that people are kind of keeping up those skills. And so you can simply upload those certificates for credit. So it's 5 for basic life support, 10 for pediatric advanced life support or neonatal resuscitation. So you can simply hop onto your portfolio, upload the card or evidence of completion, and then the credit shows up in your portfolio. To talk a little bit about the activities on the right, the ABP also has heard from pediatricians over time. One of the things they struggle with is keeping up to date with literature. There's an expanding body of medical literature, and there's other ways to get learning up to date. For example, is a great way to get some learning, but that might not necessarily help you keep up to date with the literature. And so we produce a handful of activities that we hope help with that arena. The other thing we are asked about occasionally is helping with clinical reasoning or decisions. And so I want to share some activities with you. And so the first that we produce available in your portfolio is called Question of the Week. It's produced, as you can imagine, every week. So 50 weeks of the year. We don't send one out for the year over Christmas and New Year's. The activity is made up of, so here's an example. These are the activities from May of 2023, the 4 questions that are there. Each activity has a case study, so a brief clinical scenario. There's a pretest, a 1 simple question item pretest, an abstract recently from the literature, a 1,200 to 1,250 word commentary written by one of 3 authors or medical editors. Then you are referred back to the pretest with the same exact post-test question. And then if you get it right, you get half an MOC point. For every 20 that you get right, you also get 10 CME credits. And so again, this can count for both CME for state licensure as well as MOC Part 2. And then there's key takeaways and then a medical pearl. The medical pearls are kind of just fascinating factoids from medical literature that often relate to the case itself. So here's an example from the one produced in 2023, overuse injuries. So you're with a group of parents watching a middle school soccer match, and then it goes through a case scenario. What suggestions can you give? And just here's a quick snapshot of the key takeaways at the end about growth-related conditions such as apophysitis. There's about 85,000 board-certified pediatricians and pediatric subspecialists, and 30,000 or so are signed up for Question of the Week. The people who are signed up do it regularly. About 10,000 people do over 10 questions a year. And the other 20,000 or so do somewhere between 1 and 10 questions. And there's probably about 5,000 to 7,000 that do 20 to 30 a year. We continuously get feedback that this is a valuable way to help keep up to date with practice as well as review common issues. The issue out there right now is plantar fasciitis, and we received a really nice email comment from a pediatrician. This is relevant and practical. This series is the most effective way to learn. The writing is succinct and humorous. Thank you for helping me stay up to date while making learning enjoyable. And so we hope that once you sign up for Question of the Week and you do 1 question, once you get 1 question correct, it actually comes to your inbox. So you don't even have to log on to your ABP portfolio. You can just hop onto your inbox and do those questions. You can search old questions by date, or you can search old questions by topic. So if you wanted to look, for example, on rheumatologic disorders or endocrine disorders, you can search topics based upon the subspecialty. The other I wanted to mention today is around a topic that we call decision skills. And it's when pediatricians have asked us to help with clinical reasoning. So decision skills are longer cases that involve information both from the history and physical exam, laboratory results, and x-rays. A lot more information than we could ever put, for example, on MOCA Peds or a multiple choice assessment. These are more multiple choice, kind of really built for pure learning. We present decision skills in one of 2 ways. So either in a 25-item form, which is kind of pulled random questions from throughout the field of pediatrics. But not a lot of people want to jump on anymore and sign up for 25 questions, even though you could kind of do 2 at a time and come back to it. What we've heard pediatricians ask for is, I really want to brush up on endocrinology, for example, or can you please introduce topics on COVID when it came out. So we've started to produce these shorter item forms that you can probably get through in 10 or 20 minutes with 10 questions on hematology oncology, or 5 on mental health decision skills, or 10 on endocrinology. And so we wanted to introduce the option to have questions that you can get through a little bit more quickly, and then brush up on areas that you might need where you believe there's an opportunity for learning in your own practice. And so these are both available as the longer forms, as well as each year we introduce a new subspecialty topic. I also want to jump into now MOCA Peds, which is the replacement for the proctored exam. So historically, once you pass the initial certification exam, you have to return to a testing center every 7 years to take the continuing certification exam in a prometric testing center. And we heard from pediatricians that one, the process of going to a testing center as a practicing pediatrician, you have to take time off work. It's costly and it's demeaning. You get wanded down. And the reality is cramming and purging for an exam is not a valuable learning opportunity. And so starting in 2017, we started exploring and then eventually launched fully in 2020 MoCaPeds. So I'm hoping that you're in MoCaPeds, but if not, I'll describe it a bit for you. And so the goal was to focus on assessment, which is our role as a certifying board, and learning. And so instead of just assessing you through a 200-item multiple choice exam in a testing center, we wanted to focus on learning as well. And so we combed through the literature and found a lot of information out about spaced repetition learning and immediate feedback, and tried to use that literature on learning to build a product that both helped us assess knowledge as well as focused as a learning tool for pediatricians. So what we came up with was MoCaPeds. We deliver up to 17 questions per quarter for each certification area that you have. So if you're a general pediatrician, you'll get up to 17 questions per quarter. Those are delivered one at a time via the web or a mobile device, and we'll give you a score based upon 12 quarters. Based upon 12 quarters. So we'll deliver these over 4 years in a 5-year cycle. You'll get 16 quarters of questions, but we'll only score you on 12. So you do the math, we'll drop your 4 lowest performing quarters. You can choose to do all the quarters and we'll just drop your 4 lowest. If you do all the quarters and you're passing at the end of year 3, we'll just score those 12 and we'll let you know you've passed. You can continue to do it for learning purposes. Or if you have a life event, childbirth, or a medical illness, you don't have to worry about it. We'll drop those 4 lowest quarters. There's no action that a pediatrician needs to take. And then we wanted to maximize learning, not just by giving you a question and the rationale with references, but also introducing new articles. And so we introduced 1 to 4 new articles chosen by experts in the field. For general pediatrics, there's enough clinical practice guidelines that those are almost always really high-level evidence, clinical practice guidelines, sometimes meta-analyses. And then there's articles on those questions. The questions on the articles. Those questions never show up until the second quarter. So you have the whole first quarter once we introduce the articles to you to read them. You can use resources when you're answering MoCaPeds, so you can have up-to-date pulled up, for an example. It is built for kind of walk-around knowledge and is meant to be done individually, so we ask that you not work with colleagues. And then we'll give you repeat questions. And so of the approximately 75 questions a year, 15 or so will be repeat. Those questions obviously don't happen quarter 1 because you're seeing questions for the first time. You'll get 2 repeat questions quarter 2, and then a few more quarter 3, and then about almost half of your quarter 4 questions will be repeat. And they're based upon how you've done and how you rate the questions. And so if you have questions that are relevant to your practice, highly relevant to your practice, and maybe one that you got wrong that's relevant to your practice, you're guaranteed to see that question again. So there's an algorithm that sends you questions back that are most relevant to you. The goal is not to trick you. All of the old questions are available in your question history, and the goal is to be able to look through those questions and get it right the next time. This concept of spaced repetition learning, we hope that you can take home those learnings in a way that you might not if we weren't presenting them to you in multiple times. And then if you don't like MoCaPeds, there's still the option to take the traditional exam. About 85 or 87% of pediatricians are now in MoCaPeds and using it instead of the proctored exam. If you're not in it, this is a quick snapshot of what it looks like. So this is a test question, a sample question. So you can see after the question, you get a rationale immediately. You can see the orange question mark. You can actually bookmark a question, which makes it easier to find. Every question is available to you for the entire year, but if you bookmark it, it's a little easier to go back and track. You can also see the bar to your left-hand side is what it will look like when you sign into MoCaPeds. That's where your question history is. At the end of each year, you'll also see your performance, and so we'll give you a scaled score to let you know how you're doing compared to your peers and whether you're in line to pass at the end of each year. And then all the exam content is also there. Learning objectives for the year if you wanted to prep or study. Many people don't, but some do. And then the articles that we introduce each year. There's some new features that we just are introducing, have introduced or are introducing this year. We got some feedback that sometimes the featured reading question came as a surprise, and people wished we gave them a prompt to let them know that the next question was on the featured reading. And so we've done that. And so you can now, if you are in MochaPeds this quarter and you get a question on one of the articles we've introduced, there'll be a screen before that article that says the next question will be on this featured reading. It will allow you to pull up the article. You can actually stop MochaPeds right there and review the article if you want to, or you can continue on to the question knowing that the article is pulled up and it can help you find the answer if you wanted to search through the article. We also heard feedback about the 5-minute timer, that the average amount of time it takes to do a question is under 2 minutes. It's about 1 minute and 50 seconds. But we do hear from pediatricians that there's a question or two per quarter that really stresses me out with the time bank. And so while we don't want to give unlimited time for questions, we also have heard from plenty of pediatricians that say, don't give me unlimited time. That will actually paralyze me and I'll never finish MochaPeds. We have a time bank. And so we introduced that this quarter. I'll show that in the next slide. And then if you use the app, we'll have Face ID as a screening to get into the app starting in November. And we have ongoing discussions about the impact of AI, just as an FYI, on MochaPeds, and happy to answer questions about that if there's an interest. So this is a quick shot about what the time bank looks like, both for the online platform and mobile. So you can see right under the timer that this individual has 4 minutes and 37 seconds left, and you can see a +1. You can click +1. There's 30 minutes each year. And if you click +1, that 4 minutes and 37 seconds will go to 5 minutes and 37 seconds. Or you can click +5. If you wanted to give yourself 10 minutes to go look up a topic and know that you're not going to run out. So you have 30 minutes per year. We have information from internal medicine who's got a longer and harder exam than we have. And almost nobody uses up their full 30 minutes, but everybody uses at least 1 minute. So we thought that was a reasonable place to start and look forward to. So far, the feedback's been really positive, super intuitive, easy to use. And actually, most people haven't used it yet, but at least it's there as a fail-safe should you wish to use it. We have some really nice data on MochaPeds. And so all this data is on our publicly available on our website. So one of the first questions that we ask after you finish the year is, did you learn, refresh, or enhance your medical knowledge based upon participation in MochaPeds? And you can see that over the last 4 years, that's consistently trended right around 90%. And then we're able to apply any of what you learned from MochaPeds in your practice. And again, that is going up from 61% now up to 70%. The reason it's going up, part of it might be because we're learning and improving MochaPeds, introducing more articles. The other reason is because a good portion of the people that say no are subspecialists who are also taking general pediatrics, many of whom were taking general pediatrics before their subspecialty was even available. So about consistently 20% or so, but it was a little bit more in 2020, were subspecialists who just said, no, but I'm not practicing in that area. So we believe that most people are learning and applying it to their practice, which we're thrilled about. When you think about how they're applying it to their practice, 70% say it helps them with their medical decision-making, which is kind of a very specific medical item that they've taken. I now prescribe a different antibiotic for pneumonia, or I'm able to now diagnose Kawasaki disease, or something very specific that they learned. 60%, and you obviously can see this is multi-select, give almost more of a metacognitive response. Staying more up to date. I read the literature more. This has encouraged me. This has helped me recognize that there were a few things that I've been doing for a long time that are actually out of date now, and I need to change my practice. So these kind of metacognitive things that we hope are helping pediatricians engage with lifelong learning through the MochaPeds platform. And that's to me, some of the most encouraging responses. So if you actually logged into our website now, this is one of the rotating screens. 99.4% of MochaPeds participants have passed. We define participation as answering 80% or more of the questions. That essentially accounts for the 4 dropped quarters. And so if you answer 80% or more of the questions, the likelihood is that you're going to pass. Here's the data for general pediatrics and those subspecialties that we launched in 2020. So we don't have full data yet for all 15 subspecialists, but you can see for general pediatricians as an example, those that answered 80 to 100% of the questions had an 98.9% pass rate. And of those who answered 100% of the questions, you can see 6,936 out of 6,956 passed. So again, this is not meant to trick anybody. It's meant to pass. We're building it in hopes that you learn, you enjoy it, you keep up to date with practice, and you stay certified. And so this is, I think, something that we believe has been a real positive in the continuing certification world. Just jumping into the last part before I go through a portfolio demo. This is kind of the healthcare improvement component to continuing certification. And our goal over the last 5-6 years has been to make this a more meaningful experience, less burdensome, less time-consuming, and more relevant. And so this is a snapshot of different ways a pediatrician or pediatric subspecialist could get credit for the QI work or Part 4 in their practice. And essentially 2 projects over the course of 5 years. When we first started this program probably 10-15 years ago, and really up till about 7 years ago, the icon to your left and the icon to your right were the only 2 ways to get credit. So either you were doing a large scale multi-institutional project, which was almost only for subspecialists. Neonatologists, for example, had a big Vermont Oxford network, and they would get a lot of Part 4 credit through the Vermont Oxford network. Or GI docs could collaborate on inflammatory bowel disease through this huge national network called Improve Care Now. It wasn't really accessible to general pediatricians. So most general pediatricians were doing online quality improvement modules, the performance improvement modules that the ABP produced. And there were only so many of those that any organization could produce. The American Academy of Pediatrics produced EQUIP modules, and there were about 23,000 pediatricians a year or so doing these modules. It was the old hand washing joke. The relevance ratings for those modules were relatively low, and there was frustration in the community about those options. So everything you see in the middle, from your own QI project all the way to Pediatric Community Health Initiative, are new things that we've introduced over the past couple of years. So there's the ability to submit your own QI work, and that's what the icon looks like on your portfolio. If you're doing work within your practice, there are some AAP state chapters that actually sponsor QI work for general pediatricians and give credit for the ABP on the ABP's behalf at the state level. There's also large organizations that can sponsor QI projects and give individual pediatricians credit. But you can submit your own to the American Board of Pediatrics. If you're part of a patient-centered medical home, it's a seamless way to get credit. You can get all of your 50 points or the equivalent of 2 projects by being part of a patient-centered medical home. It's a streamlined application where you let us know the PCMH that you're part of, and then answer a handful of questions about the QI work that you're doing as part of that patient-centered medical home. The other thing I'll mention for your own QI project is if you do a project and say you're working with another pediatrician or 2 pediatricians in your practice, only one person submits and the other 2 get credit. There's something called group code that you can give out, and pediatricians can then claim credit through that group code. We've introduced a couple new mechanisms of getting credit, and I'll just touch base on the one in the purple icon, Pediatric Community Health Initiative. While pediatricians are routinely learning QI in their residencies right now, that wasn't the case for many of us who went through 25 years ago. But pediatricians have always engaged with their community in improving the health of that community. And while the application is similar, there's no kind of QI lingo to the application. It's really about what did you identify as a gap in your community? For example, we recognized there was food insecurity. Who did you partner with? We partnered with the school systems and the local food banks. What did you do? We opened up food pantries, or we worked to secure free lunches for the local schools. And then what's the outcome? We set up 5 food pantries that serviced 5,000 to 10,000 people, or we set up school lunches in 10 communities that free school lunches in 10 communities that serviced X amount of kids per year. And so it's worded and meant to give credit for pediatricians who are working in their community, just not using QI methods, but doing everything to improve care in that local community. And so we've already received a ton of really fantastic applications from pediatricians who are working at that level. And then lastly, we still do produce online quality improvement modules. I'll mention one or two, and the relevance ratings for those have gone from about 60, 70% relevant to practice because people were just jumping through hoops. Everyone we produce now, except for one called virtual QI, which is really meant to be not relevant. It's meant to get credit for those not practicing. All the ones that are meant for practicing physicians have relevance ratings of 94% or above. Here's just a quick snapshot of the patient-centered medical home options with a story about that that came out about a year ago, and I'll show you where you can access that in your portfolio. And as I mentioned, we still do produce some online modules. This one's specifically related to the behavioral mental health crisis. So it's a roadmap for supporting emotional health for children with chronic conditions and their families, recognizing that we've heard from patients that what's sometimes a lost art is when kids have medical chronic illness, we often forget to ask about their emotional health. And this is a quality improvement module designed to help think about the emotional health of children who deal with chronic medical illnesses. So I'm going to actually minimize my screen right now, jump into a portfolio demo. And I'll just use my portfolio. There's nothing secret in it. This lets you know that I have the same requirements that you all do. So when you hop onto your portfolio, what you'll see is this maintenance certification page tells you most of what you need to know. So I'm certified as a general pediatrician. I'm meeting MOC requirements in that area. I've done my annual payment this year. I've completed MOCA Peds, and so my next MOCA Peds begins in 2026, or I need to pass my next exam by 2030, so that's clearly outlined here. You can even see MOCA Peds over to the right. Because I've already passed, it says optional, so I can still participate, but it's optional for me now. And here's the part 2 and part 4. So this is where you can kind of search what activities we have available. And these are so you can either jump into part 2 or part 4, and you can see the screen changes slightly. So for part 2, if you wanted to see the activities that we have available for you, clicking free with MOC enrollment is really everything the ABP produces. You can see we have partner organizations that will produce things for us as well, but there might be a charge for some of these. And so free with MOC enrollment, you can see this is decision skills. This is one of those 25 item forms that are available for your decision skills. Or if you wanted to cruise down a little bit further, here's a COVID decision skills. This is retired in August of 30 because the questions are old, but this is one of the shorter decision skills forms. I didn't mention these as much, but we also produced article-based self-assessments. And so this is a group of about 10 articles and 25 questions about substance abuse and mental health in adolescence. And so it's meant to bring 10 articles that we believe you should read in pediatrics and on a focused topic. And I'll mention a few more of those at the end and what's coming next. So we have some article-based self-assessments as well. Like here's where also you might find claiming ABP MOC Part 2 credit for advanced trauma life support. And they're alphabetical, so if you went a little bit further, you'd find basic life support as well. So you can kind of scroll through these, and you can see there's a couple pages where you could scroll through and look for activities that the American Board of Pediatrics produces. And if you wanted to look at Part 4, you can see a little bit differently. You have these big icons. So if you wanted to submit your own QI project, it's here. If you wanted to do that pediatric community health initiative, it's here. Patient-centered medical home is here. That'll open to a window that just takes you to one screen, and then you could launch your activity, and the application will open up in the new window. And here's still where all of our online QI modules are. And again, if you click free with MOC enrollment, it'll just pull up all the ones that we've produced. If you unclick it, you'll see all the AAP equip modules as well. And so here's the first one I mentioned, a roadmap for supporting emotional health. The other thing I'll mention is once you click on something, I'm going to go back to part 2. There's also search functionality. So if I wanted to do kind of question of the week, you can see that the search functionality works, and that's where I bookmark the activities. So you can bookmark an activity right from the screen. And if you like question of the week and you don't want to search for it each time, you can see my bookmarked activities up here in your main scroll. And that'll just show you the things that I've bookmarked over time. So just the last thing I'll share is what's coming next. So question of the week, we have a two-part series coming up in September on childhood bereavement. Again, it's come out of, we often ask pediatricians, what's lacking in your education? Where do you feel like you could use some help? And the idea of childhood bereavement's come up a couple of times. And so we have a two-part series co-written with David Schoenfeld, who's an expert in California on this topic. There's also going to be links to free videos that he has accessible that also have MOC and CME credit. I mentioned that we have article-based self-assessments that we produce, one coming out probably in the next 30 days are 10 recent articles on the treatment of anxiety and depression. So the best evidence around treatment of anxiety and depression, in hopes that you can apply some of that to your practice. And then we have some QI templates coming out. And these templates are meant to kind of guide you through a QI project or make it easier to document if you've done a QI project in this area. So it's really a guided approach towards either doing a new project or documenting one that you've done, just to take some of the steps away and make it easier. So we have one on behavioral mental health screening, should come out in the next month, and you'll have 4 options: depression, postpartum depression, anxiety, or suicide. Following shortly after will be a QI project and a template on the management of anxiety or depression with some resources available. We recognize that pediatricians are using emerging technology, whether that be telemedicine or large language, artificial intelligence, to improve the efficiency or improve clinical care. And so there's going to be a template coming out to help you, guide you through that. And again, a simple example could be that you're using artificial intelligence, large language models to help you get letters of medical necessity written, and you realize it saves you a certain amount of time per week, or charting time per week, or something like that. We believe that QI doesn't just include improved patient care, but if you're becoming more efficient in your practice and it's improving the overall health and well-being of you and your provider, you and the physicians in your practice, it's a win-win. And then we have lastly one about preventing firearm injuries through effective conversations and safe storage, coming out probably towards the end of the year or early next year. And that's really all I have. Want to thank you all for having me today. We really look forward to visiting you in Laramie at the end of October. And if you ever have any questions in between, we have people that, a fantastic group, Kimberly on the phone is one of them, that help answer questions about MOC. We never want you to feel like you're struggling. Just reach out to us. We're happy to help. And then around MOCA Peds deadlines, we have somebody on till midnight every MOCA Peds deadline, in case there's questions that you might have at the last second. So I'm going to stop sharing, minimize my screen, and happy to answer. Thank you so much for the time today, and happy to answer any questions.